These gentlemen also had a very unique case, and it was a bus driver who became unresponsive while driving a bus and ran into a post. When they got there, the patient was unresponsive. They had to pull the patient from the bus and start doing CPR on the street. After 10 minutes of CPR, these gentlemen received ROSC, which is the return of circulation as well. They did a 12 lead. It was determined that the patient had ST elevations, and the cath team was activated from the field. After a successful intervention to the right coronary artery, the patient was transferred to the CCU. The patient was restless and uncontrollable, moved extremities, and was unable to follow commands. The patient was considered and placed into hypothermia protocol, which is where they cool the body down. The patient was cleared neurologically because at first they thought that maybe she possibly had a stroke or something, a hypoxic event of her brain. But the patient has since returned to work, believe it or not, and is gradually moving back to normal daily activities. Because of the effective teamwork of these men, they had a dramatic effect by improving the mortality and neurological outcomes of the patient who they helped survive cardiac arrest. It's very important, the relationship we have with the fire departments and first responders, especially when you talk about cardiology and trauma, because there's just a limited amount of time that we have for positive outcomes, positive patient outcomes. So for us to have a good relationship, for them to know us to know them, know the procedures, know what has to be done, what we're looking for in them, what they're looking for in us, it just creates a better patient experience and creates better outcomes. As you can see, years ago we didn't have the CPR saves that we do now because of the technology and everything these gentlemen and women have. Also in terms of cardiology with the telemetry, that we can get them up to the cath lab so that way we can save heart muscle and they can do interventions like stents and catheterizations in a much quicker manner.
The American Heart Association has a Mission Lifeline initiative that recognizes pre-hospital care of patients who are having heart attacks. And several of our municipalities this year were recognized and awarded for their efforts and coordinated care with the hospitals and our cardiologists.
We have a newcomer to the club. We have a newcomer, which is fantastic, right, you guys? So the city of Sterling Heights, who recently started transporting and bringing patients to Osipaco, is also recognized by Mission Lifeline.
Yeah, absolutely. What they've done is outstanding. Like you said, they're just recently transporting patients, and this is their first year being recognized, and they achieved a silver award, which is the only award you can get in your first year, and I fully expect them to get the gold award next year. What they're doing is coordinating with the hospital and saving lives, and we wanted to recognize that and celebrate what a great job they do.
Yes, transport is brand new, and every year the American Heart Association gives away awards for STEMI times. STEMI times start from the call that we get when we hit the doorstep, and so we can bring them to the hospital so they can get the treatment. And we were not eligible for our first year because we didn't have a full year. This is our first year, so being our first year, we did acquire the highest level we could get for our first year, and that is a Silver Plus award. We could have got a gold, but for some reason they don't give the golds the first year. So our guys are doing well.